I think one of the things that you mentioned that I think is interesting is like at the beginning there was a lot of death, and even if you're in a field where maybe people are exposed to more death, like I've heard it was different, and the way it felt for people was different. And I was
Oh,
wondering if you could talk about that some.
it was very different. A lot of it is because I think a lot of it is that we are used when a patient dies, who's very sick, whether it's an acute thing or something chronic, and there we have an understanding of why, like at least we think we do, have an understanding of why it happened and why it's happening, and we can explain it. We can. I wonder if we can almost what is it, intellectualize things to help us understand why this happened. It's terrible, but it happened. But I think for a lot of physicians, especially ones who are more experienced and have, feel like they just have things on like Rolodex in there, having the unknown completely just enrapture everything, and for somebody to just fulminantly pass without feel the feeling of not being able to do anything, really makes physicians uncomfortable. But they were, a lot of nurses obviously left. And there's been doctors who specifically left because they're like, I can't do this. I'm done. And they're not ill. They're in they're old. They're middle aged. They have many years ahead of them, but they just like have left. But there were some things that everybody was really perplexed and had no answers. And that makes a lot of doctors uncomfortable, like the unknown. And because I think a lot of us go into medicine because it's something that you can see and feel and you can understand. And there's a way and process in which things work. Trying to explain things, the ambiguity of things makes some uncomfortable. So I think a lot of that was hard.
So you mentioned in the nurses, you're seeing a lot of nurses who felt disheartened and some nurses who left their jobs. I'm wondering in the physicians and the nurses and you, how this affected your mental health.
As much as, especially in our field, we acknowledge mental illness. Of course, it's something that I so wish was not taboo. And even, as much as it's one of those things that you say isn't taboo, but it's tabooed, it's just complicated. But I think a lot of it was more delayed. Like I know some colleagues who like I was honestly surprised at like certain things that they were doing or certain things that they were not doing, and I didn't understand why. But then eventually they would say that it really affected me. It really messed with my head, and really I felt responsible, and I like that blew my mind, because I think that what we did was good work. I mean, we tried our best, and I think it was a terrible situation anyway, and I feel like we gave our all, but to see people who had a similar experience and feel like responsible for it, like, or feel guilty for it, or feel like they should have. I don't even know how that's something. I feel like that sucks. That sucks to feel that way. And I think that it was very delayed in communicating that, but I'm pretty sure they felt it. They just felt like they can't say it, because you always have to be in a place of strength, But with regards to how I see death before, during COVID, and then now, I mean, I hope it never dissipates. I think at this point it probably won't. But I have a lot of empathy, and I feel a lot. I cry. It's interesting. I actually cry for like the littlest thing. I've always been that way since I was a little girl, and I do it even when I look at a patient sometimes. But I remember some of my colleagues saying, "Oh my God, are you okay? Are you okay? Are you okay?" Like in general. But I told them, no. This is not like crying. Like the crying. It does not limit my ability to work or hinder me in any way. It's just something that happens, and I let it happen. I just let it happen. Like it's like something, my amygdala just does it, and then I get back to work with more motivation to do what I guess what made me cry, with more intensity. So I've never seen it as a negative, and I never tried to stop doing it, because I feel like it's a good sign. It's a good sign. So no, it still happens every day, and it makes me realize that I haven't lost that,